Bipolar disorder versus borderline personality disorder. Getting the right diagnosis often isn't easy for psychiatric conditions. In this field, we don't yet have biologic tests that can easily define one condition from another. If your blood pressure is 140/90, you have hypertension or high blood pressure. In mental health, we have to rely on a description of patterns or symptoms to make diagnoses. This model is fraught with challenges. Without a clear biological model to work from, and given the complexity of the human brain, the field has settled upon dividing these descriptions of symptoms into syndromes. The Diagnostic and Statistical Manual of Mental Disorders holds these symptoms descriptions in order to help professionals make reliable and consistent diagnoses. However, the diagnostic process is more complex than just reading symptoms in a DSM. Let's focus on the sometimes confused conditions of bipolar disorder and borderline personality disorder. In a snapshot, they can look similar. Both can present with impulsive behavior, intense emotions, and suicidal thinking. But this snapshot is not the best way to tell them apart. It's really the movie of the symptom presentation over time that can help make the diagnosis distinct. Classic bipolar disorder type 1 is easier to differentiate from BPD than bipolar 2. True manic symptoms, often with hallucinations, are the hallmark of type 1, and these symptoms are not seen in the same way in BPD. Bipolar type 2 is a more challenging diagnosis to differentiate from BPD because the classic manic episode is absent. So, on the surface, it can appear more like BPD. Here are a few ways to tell the difference between bipolar and BPD. How often do moods change? People with bipolar type 1 have cycles that switch from a depressive state to a manic state. Manic symptoms sometimes include flashes of deep depression within the manic episode, called rapid cycling. Between cycles, people often have periods of true symptom-free wellness. This period of wellness can last weeks, months, or years depending on the person. People diagnosed with BPD typically have more persistent day-to-day emotional systems which can impact everyday life. BPD mood changes are more persistent, short-lived, and reactive to environmental factors like stress at work or home. Is sleep normal? Sleep changes are often an early indicator of a bipolar disorder. During a bipolar episode, a person may be awake for days and not experience fatigue, or they may sleep for days. Meanwhile, sleep patterns are less commonly impacted in BPD. Is there a family history? Mood disorders like bipolar disorder and depression run in families but aren't directly passed on through a single specific gene. A family history of mood disorders increases the chances of mood disorders appearing in relatives. Are relationships often unstable? Intense relationships, often fraught with conflict, are the hallmark of borderline personality disorder. People with BPD often have intense relationship histories, and many of their experiences with emotional dysregulation, intense reactions, and variabilities are in response to relationship interactions. Is self-harm a symptom? Self-harm, such as cutting one's skin, is more common in BPD and is thought to be a way to help with emotional regulation. I'm not suicidal, I was just trying to change my feelings by cutting, I've been told by individuals with BPD. In fact, 75% of individuals with BPD have cut, burned, hit, or injured themselves. Diagnosing a mental illness isn't like diagnosing some physical illnesses. It takes a lot of observation and understanding to find the right diagnosis. If your diagnosis doesn't feel right or isn't clear, it's best to talk to your clinician. Ask about your diagnosis and treatment plan and be engaged in the diagnostic process. If you and your practitioner aren't sure, ask for a second opinion. It's okay not to be sure, and it's smart to keep learning.